Okay, na? Hi everyone. My name is Dr. M. Niharika. I am working as a fertility consultant in Kamineni Fertility Center. Today, 1st of December is celebrated as World AIDS Day. In view of or to help people understand and promote more information about the AIDS, which is the acquired immunodeficiency syndrome, which is caused by the virus, human immunodeficiency virus. So, all over the world, 1st of December is celebrated as World AIDS Day. So, I take this occasion to help you understand and explain whether a patient who is suffering with HIV or any other viral infections can undergo treatment or assisted reproduction and have a healthy child and a healthy mother. So, this we usually call it as medically assisted reproduction in patients who are suffering from viral infections or diseases. So, the most common, there are 3 to 4 most common viruses that we deal with in a day-to-day life, that is human immunodeficiency virus, then hepatitis B virus, hepatitis C virus, and human T lymphocyte virus 1 and 2. And the other less important or less known to or researched viruses are about the Zika virus, which was seen in a pandemic recently about 4-5 years ago, and the recent COVID virus infection. So, these are the most important or most researched in viral infections that we see today, and according to 2015 census, we see that in the world almost there are about 37.5 million people who are suffering with HIV infection. So, that brings the prevalence to about 0.8% of HIV infection. And also with the introduction of the highly active antiretroviral therapy, which is the drug treatment that we give for a patient suffering from AIDS or the HIV infection in order to reduce the viral load or decrease the symptoms. The longevity of the people who are suffering with these infections is increased, and many people are now thinking about bearing a child because they are more entering into the reproductive period of life. And the people who are suffering from viral infections are mostly seen in the reproductive age group. So, because of the improved antiretroviral therapy, the viral load in the body can be decreased to as low as 50 copies per ml, which in some developed countries can be even considered as the patient is no more infected to others. So, the drugs have improved to such an extent, and therefore, the longevity of the person with the infection is increased, and now they wish to bear a child or marry. So, I will detailedly explain you about the HIV infection first and then the other viral infections. But mostly the precautions or the mode of treatment that we do for these patients with viral infections, all the viral infections is almost similar. Basically, HIV virus is an RNA virus, and with the help of the reverse transcriptase enzyme, it gets converted from RNA to DNA and then goes and binds into the human cells. So, mainly it is seen in the lymphatic cells, and the most common cell that is affected by the HIV is the CD4 T lymphocyte. Okay. So, what this virus does is it goes and incorporates into the gene of the CD4 cells and then destroys them, and therefore, there is over a period of time depletion of the CD4 count in the body. Now, what happens if the CD4 count is decreased? CD4 count is essential for us because these lymphocytes help our body, protect our body from the other infections. So, whenever we are faced with any infection or virus is introduced into the body, lymphocytes are the ones that come to the rescue first and try to destroy the virus as much as possible. But if the virus is very virulent or it cannot be destroyed by the regular cells, then it in turn causes infection to us. So, the HIV virus binds to that of the CD4 cells gene, that is the DNA, and destroys them. So, over a period of time, as the infection increases or the viral load increases in the body, because the CD4 count is going to get decreased, there is nothing for the virus to be stopped, and therefore it undergoes a maximum replication in about a period of 6 months to 1 year. Sometimes the disease is very slow progressive, but eventually there are some symptoms, and from symptoms too it can sometimes be very severe and end up in a patient having the acquired immunodeficiency syndrome. Because of the virus depleting the CD4 count, the disease is termed as immunodeficiency, because apart from this, the virus, because of this infection, viral infection, patient cannot tolerate any other infections, then they are prone to more and more number of infections. So sometimes there can be multiple infections in a HIV positive patient. So this is the pathology, or how about the virus affects our body. So first it affects the lymphatic cells, that is CD4 cells, and the other it is mostly present in the lymph nodes, which are nothing but bunch of the lymphocytes present in the body that are present in the different parts or different locations in the body. Later from the lymphatics it spreads into that of the blood, and from the blood it can enter into the body fluids, which is nothing but the breast milk or the semen fluid, seminal fluid. So this is the worrisome thing that we usually worry about, because if a patient either a male or a female is HIV affected, they obviously are at risk of transmitting their virus to their child, and nobody or no parent would ever prefer for their child to be transmitting some disease which they are having. So obviously this enters the couples, or this creates a voluntary infertility, where the patients voluntarily don't try to conceive, because they are very much anxious and fearful of the disease being transmitted to that of the baby. So if both the couples are infected, still that also can be a risky thing, because sometimes there will be super infection in either of the partners. So there, in patients who are having both the couple having HIV positive, the child is at more risk of having the infection and therefore the vertical transmission is more. If there are other situations where we see either of the partner is only HIV positive, like only the male is positive or only the female is positive. So first we will understand and we do call or term these patients as serodiscordant couples. So if a patient, for suppose only the male partner is HIV positive and the female is HIV negative, we first look into whether the male partner is taking active antiretroviral therapy or not, and if the patient is on medication symptom free, and and his CD4 count and the viral load. CD4 count is within the normal range, which should be more than 400 to 600, or the viral load is less than 50 copies or in undetectable level, then the newer studies in the developed countries like Switzerland and Europe also suggest that they can even try naturally, and these patients with a very suppressed viral load are not considered at risk of transmitting the infection, be it sexually or through the blood transfusions. So this is the newer studies that say, but still in United States of America and India, which is less developed countries, we do worry that there may be a chance that even though the viral load is low, there is a chance that the patient can transmit the infection either through sexual contact or through the contact of the body fluids. So in these patients, we medically do assisted reproduction. That is why we term it as medically assisted reproduction, because the patient is having a particular condition of viral infection, that is a medical condition, and therefore they are needing assisted reproduction. So that is the most common treatment that we can offer, and it is a very safe treatment that we can offer to the patients who are suffering with viral infections. So what actually the medical assisted reproduction means is, we know that the virus is present in the seminal fluid. So obviously we worry that there might be a chance that this virus is getting attached to the sperm, but over a period of these 40 years, we have seen that there is no such virus that can get attached directly to the sperm. It is the virus that can be present only on the cells like lymphocytes, epithelial cells that are present in the seminal fluid. So it is always in the seminal fluid and not directly attached to the sperm, and that helps couple to conceive on their own or by the assisted reproduction techniques by washing the sperm. So when we do a proper washing, first with the density gradient technique and then by the swim up technique, we will be washing out all the seminal fluid that contains the virus, and only the highly motile sperms that are free of the virus can be seen in the sample that is prepared after the sperm wash. So this again has helps us, this again has shown that there is no viral load present. If still the patient is worrying, then we can also do a direct viral load test on the media or the sample that is prepared post semen wash, and then understand whether there is viral load or not. This at least helps the patient to be assured and less fearful about the infection being transmitted to his wife. So this is the safest procedure that we can do, the sperm wash, which will remove the seminal fluid that may contain the virus. But 99% of the times when the viral load in the blood is low or less than 50 copies, then there will be no virus present in the seminal fluid. So this is pertaining to if a male is HIV positive, and contrastly, if a female is HIV positive and then the male is HIV negative, then there are certain other situations where we have to consider. Even though we know that the cells are virus gets attached to the cell, so there is a higher chance that the oocytes that are present may be containing the virus, and there are also studies which show that the virus is present in the follicular fluid surrounding the oocyte. So a proper pre-exposure prophylaxis can be given to the patient, but if the patient has if the patient is on regular medication and the viral load is less than 50 copies, even the follicular fluid doesn't contain much of the HIV virus. So whenever a patient wants to undergo treatment or wants to try to conceive, we first make sure whether the patient is on the regular antiretroviral therapy and her CD4 count and the viral loads are within the normal range, that the infection is very submissive or suppressed. Then we can help them understand that there are chances that you can conceive even naturally. But if a female is positive with HIV, there is always a chance that there might be a vertical transmission from the mother to the baby. But with the use of the recent highly active antiretroviral therapy during the pregnancy and lactation have helped the mother to decrease the vertical transmission from the mother to the baby by about from 30% in the past to about less than 1% in the recent studies. So such is the effect of the antiretroviral therapy that we see. So this is with the pertaining to the HIV infection, and for that matter to think about any other viral infections, even the hepatitis viral infection and the HTLV viral infection have similar scenarios where they can be present in the body fluids, and whenever we are going to start a treatment protocol for those patients, we have to first analyze whether the viral load is in the suppressed range or not. If the viral load is in the suppressed range, then we can help the patient to conceive by following proper equipment or the proper kits in the lab, and then help them understand whether it is possible to conceive or not. So what we mainly do in a medical assisted reproduction is, first we have to confirm whether the viral infection is present or not, and then whether the patient is taking the proper antiretroviral therapy or not, and whether the viral loads and CD4 count are normal in HIV. If it is in hepatitis B, the viral load is in the submissive range or not. Then at every step we always have to follow the universal precautions, so that we tend not to harm or the health workers that are handling the gametes or the blood of the patients. Then at the time of the procedures as well, we duly follow all the universal precautions, and in less developed countries and developing countries, we still follow the pre-exposure prophylaxis, where we prophylactically give the medicines, so that at the time of the coitus, if the patient is fearful that he might have a transmission of the disease, that pre-exposure prophylaxis will help them to control the viral load, whatever it is entering in the body because of that coital act. So such is the advancements in the treatment that we follow to help couples with the viral infections.